My name is Ben. I've just completed the Master of Public Health at Sydney School of Public Health. This year I've also been the President of the Australian Medical Students Association, and next year I'll return to studying medicine also at Sydney Medical School. I've completed 3 years of a medical degree, which I've really enjoyed, particularly all of the clinical aspects, the one-to-one patient contact. But what I've also realised as I've gone through that is just how significant a burden of disease there is, especially how many opportunities there would be to influence that early on if we could get better preventative or early interventional measures in place. The Master of Public Health has had quite a large exposure, at least the program I've chosen, to biostatistics and epidemiology, which is very helpful when you're reading and trying to critique papers. We've also learned about qualitative health research, which is very useful, again, for trying to understand how to interpret or perform your own qualitative research. One of my favourite lecturers was Associate Professor Tim Driscoll, who teaches the epidemiology unit in first semester. Tim makes a very good effort to ensure that epidemiology is applied in real-world scenarios, sometimes using projects that he's worked on himself, and has a very fun energy that he brings to both the lectures and the tutorials that I was lucky enough to participate in. There was a particular unit that I studied this year called Sex and Society, which was a very interesting topic to be studying, but even more so because I was in a classroom which predominantly had students from Africa and from Southeast Asia. But it made for a very interesting experience to discuss some of these interesting topics with people who had very different cultural backgrounds to me. For any medical students who think they might be interested in public health, I'd really encourage them to look at this particular degree. Beyond being able to help you analyse and critique papers better, it might also assist you to perform your own research, and increasingly some of the specialty training programs are requiring you to demonstrate interest in higher degrees, and the Master of Public Health can be a really good complement to your other experiences through medical school and upon graduation.